Hello, everybody. Welcome back to the Savvy Healthcare channel. Ooh, friends, it's such a terrible time to be poor in America, irrespective of your political views. The cost of healthcare is so high, even that doctor, that quack doctor from The Simpsons, Dr. Nick, even he's looking a little out of everyone's price range right now.
Dr. Nick, this malpractice committee has received a few complaints against you. Of the 160 gravest charges, the most troubling are performing major operations with a knife and fork from a seafood restaurant.
But I cleaned them with my napkin.
The Medicaid cuts on the big, beautiful bill have started to be implemented. And who would have thought that cutting the budget up to 10% would cause such a catastrophic trickle-down effect? Medicaid covers about 23% of Americans and costs the federal government about $900 million a year. Sorry, I meant billion. $900 billion. The big, beautiful bill wants to cut Medicaid spending by about $1 million over the next 10 years. Sorry, I meant $1 trillion. Cut $1 trillion over the next 10 years. I'm just not used to big numbers. And their reason for cutting the expenditure is to prevent waste and increase personal accountability.
Listen, to keep his health insurance, I want you to apply for a job. You don't have to work. Just apply for a job, go get an education, volunteer somewhere, be involved in the community, or take care of one of the kids in the family, help out a little bit. If they say no, you say, well, I'm taking your insurance away. That's not an unreasonable deal to make, and 80% of Americans think that's fair. So nobody wants to throw people off Medicaid. I want people who can and should be on Medicaid to remain there.
So what do these budget cuts mean? And who's getting affected? Well, of course, it's the people on Medicaid. Not everyone, but it's estimated about 11.8 million Americans will lose their Medicaid coverage.
Good afternoon, everybody. I'm still not selling anything, so hang out for a few minutes. Today is a little serious for me. You can officially say that you know or you have seen someone who no longer has health insurance. My Medicaid was cut off after 15 years of being on Medicaid. I no longer qualify, according to the administration. I require for my life medications. I take 23 pills a day. From about a dozen medications. My total bill, if I were to buy them myself, which I can't afford to do, but it's $1,168 a month for my medications. I am not going to be able to afford that. I just afforded what I could. I got 7 medications out of 12. I can't buy the other ones. Some of them are just way out of touch. There's nothing I can do about it. There's no one to reapply to. There's no one to complain to. There's really, I'm shit out of luck, basically.
This man is on a fixed income, and so with the new income requirements in the big, beautiful bill, he's not poor enough to qualify for Medicaid anymore, but he's not wealthy enough to afford the medication that he needs.
I lost my health insurance today. I am currently on an oral chemo that gets shipped by the specialty pharmacy every 3 weeks. It was supposed to be shipped today, and that won't be happening. I am incredibly lucky that I'm returning to work tomorrow, and I've been on a leave of absence, so my employer coverage starts back up immediately tomorrow, so I have 1 day without insurance. I was supposed to have a colonoscopy today. Thankfully, I was able to just reschedule that. That's fine. I don't have any colon cancer symptoms, so it's just, screening. So I'm okay. But if this had happened 1 year ago today, when I was in the middle of, really serious chemo treatment for my very aggressive cancer, I would be screwed.
Another thing is that this bill may actually increase out-of-pocket spending for families on Medicaid by like hundreds or even thousands of dollars annually. With the big, beautiful bill, expect uncompensated care to increase. This is when people without health insurance or money just go to the hospital and don't pay. And then the hospitals are left with a bill that's uncompensated. See, hospitals in America are required to treat patients regardless of their ability to pay. So you get treated and then you go home and you receive your medical bill. Whether you pay or not, that's another story. And that also means we should expect medical debt to increase.
I'm 36 years old and I'm about $3 million in medical debt. After a heart attack, open heart surgery, and life support, I was 8 weeks in the hospital. I'm a retired veteran or medically disabled veteran. And you would think they would cover it. I showed a video like this when I first got to the hospital back in November, and I showed this bill right here, totaling $500,000. And everyone said, it's not $500,000. You only owe $22,000. Your insurance paid the rest. Yes, you're correct. But what about these other hundreds of bills that I haven't even opened some of? Let me give you an example. This one says amount $1,400. Veteran responsibility. The VA only covered $400. I owe $12. Let's get another one. $1,200. $22,000. Veteran responsibility $500. VA only approved $134. I owe $424. Veteran responsibility $2,080. The VA only approved $432. I owe $1,647. I could keep going with this. I have hundreds of bills that I haven't opened. I don't know when I'm going to get around to it. It gives me anxiety. Yes, I'm still on hundreds of medications that I need to survive. Good news is I just got pulled off of dialysis. I no longer need dialysis. Well, I surgically have this placed into my chest, this device, as you can see here, and it needs to be removed surgically, anesthesia. Guess what? The hospital that put it in called me yesterday and told me the VA denied it. The VA did not give them the green light to remove it. So I'm stuck with this fucking catheter in my jugular vein through my chest, and the VA won't approve of removal. You wonder why people are pissed off at the American health system. I have millions of dollars in debt after just surviving surgery, open heart, life support, medications for years to come, and they can't approve a fucking catheter removal? This is bullshit. America, get your fucking shit together.
$3 million? Huh. Even if I sold all my organs on the black market, I still don't think I'd be able to raise $3 million. Already, about 65% of all bankruptcies in America are because of medical debt. And now we'll probably see this number go up. The big, beautiful bill is also cutting the funding for behavioral and mental health by about 10%. And this includes substance use treatments and disability.
This is going to be a universal problem. If you think that people who are on Medicaid not being able to get their medicine, not being able to get treatment, I work specifically in the mental health care field. If you think those people not getting their lithium and Lamictal and Risperidol and all of those other medications is not going to impact you, baby, I got news for you. Also, to piggyback off of what another creator said, have you ever seen a person who's experiencing psychosis and mania try to hold down a job? We're working 80 hours a month. Not happening. But this is the problem when we have uneducated people in office. I'm sorry, I don't get political, but this affects me and what I do. And I love what I do. And I love the people that I serve. And it's sad to think that I'm not going to be able to provide the services that I need to provide for them. Sometimes we're their only outlet. Most of the time, we're their only advocate. And we're also the ones who are pushing people to continue therapy when they've said, hey, look, I'm fine living this way. Or, you know what, the medicine is working, so I'm going to stop taking it. Because that happens too. The symptoms go away. And we're the people who say, hey, continue on your treatment plan. What's going to happen when those services are no longer available? Being reactive in the medical field has never been beneficial. Proactive works. Staying on top of medication, staying consistent in treatment works. What are we going to do when these millions of people are removed from medical care, access to medical care. I'm just honestly like, my mind is blown that this was something that was even passed. And again, we talk about the war on drugs and the war on this and the war on that and all that BS. But at the end of the day, nobody cares unless it's in their backyard. And I guarantee it will be in your backyard at some point if you're one of those people thinking that it doesn't impact you. That's it. I have nothing else to say. Call me an angry social worker. It is what it is. Call me an angry therapist. Fine. But I see the writing on the wall, and hopefully you do too.
And you know what's ironic about this budget cut for mental and behavioral health? Is that with the economy the way it is, it's driving all of us crazy and broke. If things don't change, we may just end up needing mental health services from Medicaid because that's all we can afford. Rural hospitals are also being affected by the budget cuts. You see, rural hospitals mostly depend on Medicaid funding to run, and half of them already are operating at a deficit. Listen to this lady talk about it.
Let's pretend you're a hospital and see how the Big Beautiful Bill Act affects you. You own an average run-of-the-mill hospital. 2 patients come in and they both need emergency medical care. One patient has commercial medical insurance, the other one does not. The care for both patients costs $2 each. $2 for patient 1 and $2 for patient 2. For patient 1, you go to their commercial insurance payer, you negotiate, you get your $2 back. Patient 2 can't pay the $2, but because the government knows that they're living in poverty, they agree that they are going to pay you, the provider, the $2 on the patient's behalf. The costs are $4. You have $4 in your hand. Now, let's say the government says, you know what, we're actually not going to pay for some of these patients. So the next time when the 2 patients come in, your cost as the doctor is $4. Now, you get $2 back from the commercial insurance payer, but these other $4, the government says, we're not paying that. So what do? You go back to patient 1 and you say, hey, unfortunately, I'm going to need $4 from you, patient 1. Even though your care only costs $2, I'm going to need $4 because I need to cover all of these costs. Now, let's take this a step further and assume that you, Dr. Jean, you are a doctor who owns a rural hospital instead. So now, instead of half of your patients having commercial insurance and half being under the poverty line, now both patients are under the poverty line. So now if the same 2 patients come in, and they both need emergency care worth $2 each. Now you don't have a commercial insurance to bill for any of this. And also the government said, hey, we're not going to let you bill us for this either. So what do you do with your $4 costs? Nothing. You can't pay your doctors, you can't pay your bills. And so eventually these $4 build up and you close. Not patient 1 and patient 2 who had to come to you for emergency medical care, except now that you're closed, now they have to go somewhere else, somewhere further, if they make it.
There's a lot of politics surrounding the Big Beautiful Bill. On the one hand, there is the issue of reducing waste and increasing personal accountability. And on the other, the bill seems unfair to elderly and disabled people. It seems like it's targeting the poor. My opinion is, why can't there be universal health care? Not just in America, the whole world. Anyways, what do y'all think about these changes? Are you or someone you know being affected? Tell us in the comments. And don't forget to stay safe out there. Healthcare can be very expensive if you don't have insurance or if you haven't met your out-of-pocket maximums. That's where CostSavvy.health comes in. This is a completely free website that lets you search and compare the prices of medical services from different providers near you. You just type in the service you need, your zip code, and your insurance plan. Then you can compare what different hospitals charge for the same procedures. You'd be amazed by how much you can save on healthcare. Visit CostSavvy.health today.